Hi, this is Dr. Zadeh, and I'm going to show you a simple case of implant placement on the lower jaw. This patient presented with missing number 18 and 19. Teeth have been missing for a while. If you look at the CT scan, we have good amount of bone above the nerve here. The thickness of the ridge is okay. It's about 6 millimeter, and the distance between the crest of the ridge to the nerve is about 10 millimeters. So we have good bone for the good part, and it should be pretty straightforward. So let's go look at the procedure. So the procedure is done with local anesthesia. The incision is given by a cellular incision on the premolar area. The horizontal incision is done a little bit to the lingual of the crest of the ridge to preserve as much keratinized gingiva as possible. Here we are raising a full thickness flap, and both from the lingual and the buccal. Both the vertical incisions are done intracellular. So with a high-speed handpiece here, I'm making the initial osteotomies, the position of them, and basically the way I'm calculating the space is I divide the space between the two teeth in two, and then each of those spaces I go on the mid mark of those. And first I mark them with the high-speed handpiece with the carbide, and then we use the progressive drillings. Implantova implants, they're picked up, and they usually go in till about 3/4 of them with 45-50 Newton that is set on the implant motor, and the balance of it is torqued in with a 100 Newton torque wrench until the implants are subcrestal. Now, as we can see, the implants are in. The implants went in with very, very good torque. So I decided to put healing caps on them. So there is a healing cap on the number 19 area and the healing cap number 18 area. The buccal bone was very thin. We know that we need at least 1 millimeter of bone for the bone to be stable and for it to get vascularized and stay as bone. In order for that not to happen, I put a bone block, and I'm going to now stabilize the flap with the healing cap with a sling suture. This is the finished product. You can see the implants are spaced nicely, and they're all subcrestal the way the Implantova is supposed to be, and they're safely distanced from the inferior nerve. And the buccal bone, where the bone was deficient, is properly covered with a bone graft that would ensure proper thickness of the bone in that area. Now, going back to the CT scan of before, you can see that the width of the ridge is about 6 millimeter. Now, these implants are 4.5 millimeter wide. So for a 4.5 millimeter wide implant to go into a 6 millimeter ridge, we're not going to have 2 millimeter, 1.5 millimeter on each side. It will be about 0.5 millimeter, 0.75 millimeter short. So for that reason, I added that bone graft on the buccal of number 19.